what role do you see AI playing in pediatric care over the next few years? Right, we have seen evidence of pediatric surgery being improved by AI, robotics. We have seen chatbot implementation. We have seen many different of AI across multiple different domains. Which of them excites you the most, and which of them do you really envision it changing the patient care and clinician workflows over the next few years?
I really see AI moving in the direction of trying to address the part of care that's outside of the hospital. If you look at, especially with chronic diseases, and I do see chronic diseases, scoliosis, hip dysplasia, things that patients do have to monitor. And a lot of their care happens outside of the hospital setting. It happens at home, at school, traveling around the island, all sorts of things. And I think with technology advancing the way it is, we're really moving more towards remote monitoring and trying to collect more data outside of the hospital setting and using that data in an intelligent and clinically meaningful way. And you can already see people are moving in that direction. They want to wear Apple Watches. They want to use Oura Rings. They track their data with the Healthy 365 app. And they want to know, what does this mean? How can I improve my health? And I really do see that's an area we can really focus on. And particularly for kids, where that's my area of specialty, I really think there's a big room for not just remote monitoring, but also in patient education and trying to expand the ability for us to deliver care to parents. Part of being a pediatric specialist means that in addition to treating the children, I have to treat the parents.
Yeah.
Singaporean parents are a unique level of anxious. There's a lot of questions. There's a lot of concerns. And of course there are. And that's really where AI can actually help us deliver a more humanistic aspect of healthcare. I may not be able to answer questions and emails 24/7, but having a chatbot that is programmed to vet through guidelines, get help with rescheduling appointments, giving advice on when to seek medical care. That's 24/7. That's tireless. That can be accessed at any times from the comfort of their home. That's a level of care we didn't have 5-10 years ago. And that's where I see how we can take technology and use it to not replace necessarily healthcare, but to expand and extend our capabilities without having to lose that human touch. And even nowadays, research shows that sometimes ChatGPT and DeepSeek, these models perform better in giving more humanistic, more empathetic responses to parents than humans do. So it's not that AI cannot give empathy or give that human touch. It's just a matter of how you choose to implement it. And I really do think if you go in with the mindset that you have to make sure it's safe, that it's regulated, that it's ethical, that's done sustainably, that's done safely, then AI is very much something that you can use not just as a tool to extend healthcare, but to multiply its reach.